I will continue for our next team. The next team is the winner from SongKhla. We're going to talk about home health check. This is another chance for this team. Could you please give a big round of applause to welcome Ocare Health Hub.
Good morning, ladies and gentlemen. I'm Dr. Emily Shutimadunmani, Ocare CEO and co-founder. After I'm working in Thailand Center of Disease Control, there are plenty of diseases most people are suffering from. Diabetes, hypertension, heart disease, all this called NCD. Myself, I'm suffering from hyperthyroid or thyroid problem. When I know that disease, the symptoms started to get worse. But luckily, I'm still here. This is why health check is definitely played an essential role in our life. But to my surprise, only 2 less than Thai people get regular medical checkup annually, and the rest is our chance to fix it up. Two main problems we found. The first, it's not easy to getting health checkup. We have to take forever braving the traffic to the hospital, and another forever queuing up the waiting to get through the procedures. And when you get the lab results, you couldn't understand any single word. And when it comes to company, even bigger picture, imagine that you are HR executive. A month of employee health data pile up on your desk. Where do you start? Sometimes it ends up with employee have vision problem got dental benefit. All this the reason why Ocare must exist. Ocare help everyone access primary health care easier with better health insight. With 3 main things: home health care provider, personal health report, and health business intelligence. Our provider go to you. Blood and other samples are collected in only 30 minutes. Within 4 hours, all information provided online in easily understood language. And this is our examples. Our report will automatically calculate your 10-year risk of heart attack based on the real medical evidence. And for the company, we help you earn maximum benefit. Just simply input the data, then just film it. Your employee can access personal health report that easy to understand. And the HR can understand the main problem of company that related to position, age, even health situation changing each year. This is another example that we did for Chiang Mai City. NCD occur mainly into this certain area, which is the fresh market, which help the government could figure out where they're gonna start. For the NCD situations, it will be more challenging when people grow older. TDRI estimate that spending on healthcare in 2032 will explode to $44 billion. That given Thailand, like many countries, is fast becoming aging societies, that means an NCD risking one as well. To Ocare help everyone more accessible and actionable health insight. This is making us a promising player in this game. Our business model is so simple. We get 40% operation fee of each transactions. And for company, we get 100 baht per user a year. Ocare was launched, beta launched 4 months ago, and we growing rapidly. We already have had 80 on-demand healthcare provider and over 4,000 personal health report. And we also sign agreement with company to service the home health check at least 50 health check a month, starting from next month. And by the end of this year, we expect to reach 50,000 personal health report and 500 home visits. In the emerging era, personalizations is a key. We put all our effort to help people get more personal health insight and reduce the number of patients who are suffering from the diseases. I, as a doctor, as entrepreneur, committed to be a part of this big move. Together with another doctor, he works in health informatics field, and experience that we got a chance to be a visiting student at Stanford University Hospital last year and Silicon Valley. Plus teaming up the winning award member, we are the right team to solve this problem, and we can make it happen. Thank you.
Thank you. Now 5 minutes for Q&A session.
I'm just curious, do you do diagnosis?
Not diagnosis, interpretations of lab results, and give some recommendations.
Yeah, so there's no diagnosis. I
Yes.
see. Who will be your first early adopter? People who is going to use your system?
Our early adopters is a person who wants the checkup, who needs convenient checkup. And like yesterday, we got a call from the user who is the bedridden family, and they want to follow up their lab results. The doctor suggests them, and then choose to got the blood checks for them.
Have you encountered with any regulatory issues because you are collecting blood samples from people, and how can you work around that?
For collecting blood samples, it can do if there are the registered nurse or medical technicians.
Can you please go back to the solution slide that shows your product?
We have 3 main solutions: is home health care provider for get a checkup and personal health report, and for the company we give the business intelligence for company.
Can you please explain the technology behind this? Is there hardware and software, or what exactly?
Home health care provider is a on-demand platform for the home health care provider go to your home for give blood collections, and the personalized health report is visualized. You can understand the report easily, and health business intelligence is visualize your health all over data of your employee and to get the insight.
So do I understand correctly that it's a service? So in order to do this, you're sending people to the clients or the patients. It's not a remote machine or something
Yes,
like that.
For individual, it's not remote.
I'm curious because you have competitors. I think people can choose to go to hospitals or private clinics. So in your view, what prevents other competitors to jump into this business and compete with you? What sort of your unfair advantages?
The first people who choose us is a people who need convenience to know they not the person who go to the hospital or the clinic. Like I said before, that's just only 2% of Thai people get regular medical checkup. So there are 98% left can be our customers, and in the early time, they are the person who want to give if you not stay with your family and you buy the package to their family that far away from you. And for the personal health report and business intelligence, I think nowadays there are business intelligence like a Tableau or Power BI, but it's not specific in healthcare.
I'll just do a quick one. I just want to understand about your Data Privacy Act and how do you secure the information?
Okay, on IT securities, I follow by the insurance company that we're dealing with. There are the regulations of the insurance company, like penetration tests or data encryptions.
Apart from simple interpretation for your customer, is there any after-service consultation?
For the consultations, I'm prepared to connect another startup to like a telemedicine. I don't do it by myself, but I'm connect to like an API to another startup.
Do you have some security issue, like if the patient is a man, stay at home, just one person, and then you send us some nurse to get the sample?
Customer or user can access our nurse or our provider profile. And all our provider is registered as nurse. And I mean that you can access the standardized and you can see the profile of them.
I'm just curious, what is your contingency plan in the event that there's a leakage of data?
I'm sorry.
If there's a leakage of data, what is your contingency plan? What is your solution? Because there is a company based in Malaysia, actually raised a huge round, but their server was hacked. So it actually...
like I said, I'm follow the insurance company regulations. Thank you.
Thank you very much. Could you please big round of applause for our second team. And congratulations. Everybody, how brilliant they are that they can merge and combine the creativities and also the technologies all together. But then we still have another two more teams